So today's our 12th video update, and I'm happy to report things are looking pretty well right now. I will tell you that I've been talking to you and talking to the community about continuing to come in for health care, don't delay situations, so I decided to practice what I preach. So I had the opportunity to come in about 3 weeks ago now and have surgery myself on my shoulder. I just wanted to tell you that my experience here was amazing. The people that were up on 9 Courtyard Tower, thank you so much for taking care of me. The OR team was incredible to work with and see what you do actually on a day-to-day basis. But I do want to actually give a shout out to Demetrius Swilling, who is our Excel Award winner a couple months ago, who actually took care of me all night one night and really comforted me when I was coming out of anesthesia and recovering. So thank you, Al. Appreciate everything you did. In mid to late July, we peaked in COVID, and we were certainly having a run on resources at the hospital. Since that date, we've had a pretty significant decrease in our COVID census. Today we're in the 20s. We are cautiously optimistic that we're going to continue to see a downward slide, but we're going to continue to prepare for the worst. We're going to continue to stockpile PPE. We're going to continue to make sure we have resources here to take care of patients if that number starts reversing. Hopefully it doesn't, but we are prepared if it does. So the biggest thing people can do in this community, in this hospital, and quite candidly the entire country, continue to social distance, continue to wash your hands, wear a mask. When you're out in public, wear a mask. Follow the rules of your county government, your city government, your state and federal recommendations, but wear a mask, wash your hands, and stay social distance. If you feel sick at all, please stay home. Make sure you call your doctor. Don't go to your doctor's office. Call your doctor. Get instructions on what to do. And if you're an employee here, call our COVID hotline and get instructions for what to do from there. Just be safe and be cautious. So I get asked a question about, are we going to allow visitors frequently, as you might imagine. I will tell you that we're closely monitoring that right now. We don't want to do it too quickly. So we're having a lot of conversations with our medical staff, with Dr. Gordillo and his team, about when that time comes. I think it's probably going to happen pretty soon, but we just want to make sure that we're cautious about it and don't have a problem pop into our organization that's self-inflicted. Our number one resource in this community is the staff that works at this hospital. These are heroes that come in each and every day and give of themselves to protect our community and take care of each person in this community and in this hospital. We can't thank them enough. We can't do enough for them. The community has been incredible. The community has stepped up and sent food up here for our staff to enjoy and to just say thank you. The organization has done things as well. Most recently, we partnered with our partners at Boar's Head to do boxed lunches for everyone, and just a way to say thank you for what they do. We've done other things. We've had the appreciation pay a few weeks ago. We're going to have t-shirts that come out that identify them as SMH heroes and, quite frankly, community heroes. And we'll have other things that happen, but we can't say thank you and give enough appreciation to our staff. So we have quite a bit of construction projects going on the campus right now, and by campus I don't mean just the main campus, I mean virtually throughout our entire region. The big projects are, one, the cancer tower is continuing to develop. It's on a great pace. It is scheduled to open fourth quarter next year, and we're right on target. We're looking forward to that happening and coming online, and really having an asset for the community that has never been here before. The other big project that's happening is our community hospital down in Venice. So SMH Venice is continuing to proceed. We're going to open that in fourth quarter next year as well. The team down there assures me that we're on time and on budget, and we're looking forward to that coming online and really servicing all South County and really being a resource that hasn't been there in the past. Another project that has come online since our last video is our Radiation Oncology Center up on University and Honore. We've had a tremendous response by patients and physicians that utilize that facility, and we are grateful to be able to provide that to the community. We also, in the last board meeting, approved a new project, a replacement for Bayside Behavioral Health Center. So we're going to start building a new behavioral health hospital on this campus. You'll start seeing that construction maybe in about a year, so it's a few years out, but it's the first step, and it's been funded and approved, and we're looking forward to that as well. It's important that we continue to look long-term to fulfill our strategic needs of the community and our strategic goals of the organization. So we think that while the pandemic's going on, it's equally important to continue to progress in all these type of projects to keep our system and our community growing. So while this pandemic has been going on and all these construction projects have been going on and everything else that it takes to run a healthcare system, we're always under the threat of hurricane season at this time of year. So our safety team has not taken their eye off the ball. They monitor every storm that comes out, monitor everything, have our system prepared. If we do happen to have a hurricane or a bad tropical storm hit this area, we're ready. We continue to run drills. We continue to make sure we are prepared. So I'd just like to close by saying thank you again to all of our employees here, all of our board members, all of our medical staff, and to the community for everything that you've done to help support this organization. It really has been pretty amazing to watch everyone come together once again in times of need to support Sarasota Memorial Hospital. I want to remind everyone also, though, to make sure you fill out your census. It's important to make sure that we get an accurate count of census so we get our fair share in Florida and in Sarasota of federal dollars that are going to be allocated over the next 10 years. Filling out the census is just another way to support the community. Thank you.